The majority of duodenal ulcers are actually caused by H. pylori bacteria, not just acid. And this is a bug that thrives in the stomach and it disrupts the balance between acid secretion and mucosal defense, especially in the duodenum. And so in a patient with classic ulcer symptoms and iron deficiency anemia, particularly from a high-risk region, H. pylori should be your top suspect. And so a PPI is going to help you heal, but it's not going to cure your problem. That's why we need eradication therapy, particularly a combo of antibiotics and acid suppression. And that's essential to prevent your recurrence. You got to kill that bug so you can kill the ulcer cycle. So, H. pylori related duodenal ulcer, you could see epigastric pain worst at night, relieved by eating food. Iron deficiency anemia, increased fetal cold blood, chronic GI bleed, high risk for those immigrants from Asia and South America. H. pylori increases your gastric acid secretion that will damage your duodenal mucosa. You can confirm this with biopsy, urea breath acid, or stool antigens. You're going to have quadruple therapy applied, PPIs, bismuth, also metro, and tetracycline. And so this is going to be your triple therapy. So a 39-year-old man's got a duodenal ulcer found to have positive urea breath test. In addition to acid, what suppression, what is the most appropriate step? You're going to have to kill that H. pylori bacteria. Helicobacter pylori. So your PPIs help with the healing, but H. pylori, is what I meant to say, is the root cause. And so if you don't have antibiotics, the ulcer is just going to keep on coming back. So antibiotics need to be in play here. Glucocorticoids, that can actually worsen your ulcer, so it's contraindicated. Sucralfate is going to help with the healing, and that's going to alleviate some of the problems there, but it's actually not going to stop the reoccurrence of H. pylori. Your H2 blockers, those are less potent than PPIs, and it actually doesn't address your H. pylori infections. You need those antibiotics for that. Your prokinetic agents, that'd be like your metoclopramide, that would treat your motility disorders, but not peptic ulcer disorders, and so it would have no effect on the healing. So metoclopramide would actually treat the motility, not the ulcer issue. Prostaglandin, so you could have prostaglandin analogs like misoprostol, and that would prevent your NSAID-induced ulcers, but this patient has no NSAID use, and so it's irrelevant for this condition. So misoprostol and other NSAID-induced ulcer kind of alleviating medications would not be helpful here. All right, so gotta eliminate and go straight to the source of that H. pylori, get rid of it, and that's the solution, especially for duodenal peptic ulcer disease, because the most common concomitant is going to be that H. pylori, Helicobacter pylori infection. All right, yeah, that's all for now. Like and subscribe if this is helpful. See you in the next video.